Hi, my name is Dr. Tony Salamay. I'm a doctor of chiropractic, and I have an office here in Panama City, Florida, in dealing with chronic health conditions such as fibromyalgia, chronic fatigue, migraine headaches, autoimmune disorders, chronic pain, and a whole host of other chronic health problems. I also hold a master's degree in clinical nutrition, and I have several postgraduate hours in functional neurology, blood chemistry, and endocrinology. Over the years, I realized that many people like you have been greatly underserved when it comes to finding the underlying cause of your health problem. Many of you have been to, some of you have been to 5, 10 doctors and even more, and are not getting the answers, or haven't been listened to, or haven't been thoroughly tested for. And conventional medicine, they're great when it comes to emergency care. They're very good when it comes to, blunt force trauma, heart attack, stroke. But when it comes to when it comes to chronic care, they're just lost in a lost world. They treat chronic health problems with acute care, and it just doesn't work. Well, I'm here to tell you that there is an answer to your health problem. And the only answer comes when you find out what's actually causing it. And I'm sure you've heard the saying, nothing ever really goes away until you find out what's causing it. Until you remove the cause, it always comes back. And our focus here at our clinic is to figure out what's causing your health problem. And the way we do this is we use cutting-edge methodology and scientific protocols in order to find out what's causing your problem non-invasively and with natural means. Today we're going to touch on the condition called fibromyalgia. Now, if you have fibromyalgia, you know what that means, which is pain, diffused pain all around the body, in the joints, in your muscles, and in your tissues. And with fibromyalgia, many patients that we see that have fibromyalgia are under pain medications. Some of them are very dangerous, like narcotic pain medications, like tramadol, that are addictive. Some fibromyalgia patients are on Lyrica, which is actually an anti-seizure medication that really doesn't do anything to actually treat the actual problem. Others also, you might be put on Prozac or Zoloft or Cymbalta, which have serious side effects with the antidepressants and anti-anxiety medications. And a lot of people with fibromyalgia have problems with fatigue. In addition to the pain that they have, they're constantly fatigued. It's hard for them to get out of bed. They wake up in the morning. They're slow starters. In the midday, they may have a midday crash. A lot of them have immune problems as well as hormonal problems, and are problems with staying asleep as well. They can't get to sleep, and some of them have problems staying asleep. And with fibromyalgia, others have also may experience weight problems, may experience also blood sugar problems as well. I want you to know that we understand that fibromyalgia is real. Today I'm going to talk to you about the causes of fibromyalgia and the treatment methods that we use in order to treat you with the fibromyalgia. Now, another thing is we're going to look at your thyroid. We want to take a look at how your thyroid is functioning. If your thyroid's not functioning properly, then we're going to take a look at that. And we're going to be able to assess the thyroid function, and we're going to be able to do this thoroughly, because most people who have fibromyalgia are not being tested thoroughly. The way we're going to look at your thyroid, we're going to look at your total T4, your TSH, your free T3. These are all metabolic markers that are going to give us an indication of what's going on with you. A lot of people who have fibromyalgia have problems with their immune system. Their immune system is actually attacking their thyroid, and that never gets addressed usually. It never ever gets addressed because medicine does not look at immune problems with thyroid. And those things are prevalent with thyroid patients and fibromyalgia patients. So we need to look at that. Also, we're going to look at your complete metabolic panel. We want to take a look at your liver, enzymes, your kidney, electrolytes, so on and so forth. We're going to take a look at your immune system, your CBC. Take a look at your autodifferential. That's going to give us a picture about what's going on with your immune system. We're also going to take a look at these inflammatory markers that I talk about. There are many different inflammatory markers that will assess how much inflamed it is. We can be able to find out how much your body is inflamed and what's causing it to inflame. Also, we'll take a look at your adrenal stress index test. The adrenal test will tell us how your adrenals are functioning, and if they're not functioning properly, and what stage they're in. Because a lot of fibromyalgia patients, their adrenal glands, those are almond-shaped glands that sit right above the kidney. They release the cortisol. They release those adrenaline hormones that cause the heightened, increased blood pressure, increased heart rate. problems with sleep, fatigue, energy. These all have to do with those type of functionalities. If they're not functioning properly, there could be a time and day where they're not regulating. So we need to take a look at that. If this is something that you're serious about, it's something that you want to get well, then I'm serious about working with you. And I want to personally invite you into my office for a consultation. There will be no charge for that. I'll take a look at your file, take a look at all your medical records, all your diagnostics, your lab work. I'll sit down with you, go through your history, and I'll see what we can do for you. I'll tell you basically if I can help you. Now, if this interests you and this is something that you're serious about, then I encourage you to give us a call. You can also fill out your information and get your email address. We'll also, somebody from my staff will be in contact with you shortly to set up your appointment. And I want to personally thank you for watching this video. I'm Dr. Tony Salamay, and have a great day.